Does gynecomastia surgery involve risks and complications? See, any surgical intervention has a certain amount of risk, whether it be an appendicectomy or a cesarean or whatever. Every intervention on the body has a certain amount of risk. Now, is the risk significant enough to not do the surgery? No. The risk with any surgery, likewise gynecomastia surgery, to be popular indicates that the risk is very minimal. So what are the things that can happen? There are certain complications that can occur with gynecomastia surgery like in any other surgery, and the commonest of them are: number one, you can get infection. Since it is a surgical intervention involving invasion of the tissues and surgically removing the gland and fat, there is a theoretical chance that a patient may get infected. Is it common? To my knowledge, in my practice, I have never seen an infection arising due to a gynecomastia surgery. So it is extremely rare. And we give very good antibiotics, so there is no chance of an infection. And all our theatres have HEPA filters, laminar flow, and we follow the strictest protocols possible, being an NABH accredited surgical center. Second, you can have hematomas. So hematomas are nothing but sometimes, because it is a blind procedure, we are doing it with tiny holes and we are doing it with cannulas. There may be some blood vessels that open up and cause swelling, that is blood clotting and swelling under the skin. You will know whether you have a hematoma or not because you will have pain which is not proportionate to the other side, provided unless you have hematomas on both the sides, and also the swelling will increase. So, are hematomas dangerous? Not at all. If you have a hematoma, then we would have to take you back into the operating room and we will just evacuate the hematoma, and probably if there is a bleeder or spurter, which generally can occur, we will go ahead and ligate that, give you a thorough wash, and you will be as fine as before. So hematomas can occur, they are not dangerous and they can be easily corrected. The third thing that can occur is seroma. Seroma is probably a relative of hematoma. So if the hematoma is not very significant and there are a few blood clots in the subcutaneous plane, those may dissolve to form a seroma. Along with some lymphatic collections, these can occur and cause a persistent bulge or a persistent asymmetry, and this can generally occur from the third week onwards. So how do we correct the seroma? We just put a needle and aspirate it. Once it's aspirated, you're as flat as normal. So these are the three main things that can occur. Then you can have other issues like, maybe asymmetry, or you might have residual internal scarring with the hard tissues. You can have probably deformities. These are all aesthetic problems which may be manifested, much later and not in the initial stages. But the most important complications that can occur are either hematoma, infection, and seroma. And luckily, they are all very, very simple and very easy to correct. So I wouldn't worry about the risks or the complications that can occur after a gynecomastia surgery.